Welcome to Thoughtful Thursdays. Today, Dr. Faiz is with us, and he's a cardiologist, which means a doctor of the heart. And he's going to share some insights with us about heart diseases and how we can prevent them and how they relate to getting older. Welcome, Dr. Faiz.
Thank you, sir, for the invitation.
I think that when we get older, our heart starts to get older as well, and it might get us into some trouble. Is that correct?
Absolutely. Heart disease is quite prevalent with older people, and it increases in prevalence with age. As we age, our heart ages, and we're more liable to get coronary artery disease, heart failures, because of age-related diseases, processes like hypertension, diabetes, hypercholesterolemia, weight gain, mobility, and other medical problems that can lead to heart disease.
Yes, and I think because the heart is obviously, one of the most important organs that we have in our body, so that if your heart doesn't function well, then it also worsens the condition of the rest of the body. Am I correct?
Absolutely. The heart plays a pivotal role in providing oxygenation, blood supply to all cells, organs of the body.
Yeah.
And so if the heart fails, so does do the other organs.
Yes. And it's also the other way around, because the heart in its own turn is also dependent on a good function of the other organs, right?
Absolutely.
Yeah. So for instance, let's say that if somebody has a kidney disease, he might develop a heart disease from that?
Absolutely. Kidney disease has been well known to be the strongest risk factor for development of coronary artery disease or heart disease, and atherosclerosis of the coronaries that lead to fatal or non-fatal heart attacks. And actually, among all the risk factors for death from coronary artery disease, kidney disease is the highest in terms of predisposition of death from coronary artery disease.
Yeah. So basically, it means we have to try and live a healthy lifestyle if we want our heart to, to be functioning properly for the longest possible time.
Absolutely. Prevention is really the essence. Prevention is better than cure. So the aim of all doctors is to prevent patients from getting into the stage of having established disease by adopting preventive actions that includes lifestyle modifications, exercise, diet, and search for risk factors that can predispose to diseases of the heart, of the coronaries, and that can lead to heart attack, heart failure, or unfortunately death.
So if the citizen would have only the choice of making one lifestyle change, which one would you advise that citizen to do?
Actually, that's a tough question because there are multitudes of risk factors. They play additive role.
Yeah.
So the major risk factors that include hypertension, high blood pressure, abnormal cholesterol, smoking, obesity, and diabetes mellitus, and some other risk factors like sedentary life, lack of exercise. We mentioned the smoking. So each single risk factor increase the propensity and the tendency to get coronary artery disease of the coronary artery.
Yeah. I've heard, but correct me if I'm wrong, I've heard that being overweight is a condition which affects almost everything else, and that this is one of the most important things to avoid.
Absolutely. Overweight and obesity are well known to be a risk factor for coronary artery disease, meaning disease of the coronary arteries with atherosclerosis that can lead to heart attack that can be fatal. Because overweight leads to risk factors such as development of diabetes mellitus, abnormal cholesterol, and high blood pressure. And those will eventually can predispose to risk of heart attack and heart failure. Therefore, everyone has to attain a normal weight. Now, what has been known about normal weight is using an equation that will determine the body mass index. So the body mass index, basically your weight in kilogram divided by your height in meter squared. And normal body mass index in individuals who have normal muscle bulk is less than 25 kilogram per meter square. Body mass index between 25 to below 30 is termed overweight. Body mass index from 30 to below 35 is obesity, and body mass index 35 or above is morbid obesity, and this is the highest risk. So it is really very important to try to achieve an ideal body mass index less than 25 in order to reduce one's risk of developing risk factors for heart disease and for stroke.
Yeah, and I would think that becoming overweight is mostly caused by what we eat, how much we eat, and how much we move. Am I correct?
Absolutely. I mean, there is some familial predisposition to overweight obesity, so that's one factor, but the environmental factor, i.e. your lifestyle, how much you eat and how much you exercise or not exercise, determine your body weight. So there's something we can do about our weight. We need to lower our carbohydrate and calories intake, meaning not to overeat, and we need to exercise on a regular basis.
And is there anything that we can eat where we can generally say, eat this is good for your heart, or doesn't it exist? Is it all a matter of balance?
Absolutely. Diet should be prescribed to the patient as per his or her medical conditions. For people who are healthy with no risk factors like diabetes, hypertension, cholesterol problem, eating a balanced diet that is rich in fibers, rich in vegetables and fruits rather than refined sugar, and trying not to overeat and to avoid over calories will reduce the risk from subsequent development of diabetes, hypertension, and cholesterol problem. Patients who have certain conditions like diabetics, their calories should not be more than on average 1,900 calories. Patients who have hypertension, their diet should be a diet that is very low in salt, sodium, and high in potassium, and that's called the DASH diet. It's like the Mediterranean diet that's very rich in those fruits and vegetables and raw nuts, and white rather than red meat, in order to reduce their salt intake and prevent them from having uncontrolled hypertension or high blood pressure that can lead to stroke or heart attacks.
And you mentioned cholesterol, and I know that there's been a long ongoing debate about cholesterol in eggs. And first they said you shouldn't eat eggs, you should eat them very sparingly. Then they said no, it's okay because it's the body which makes cholesterol anyway, and if you eat more eggs the body will make less cholesterol. I'm not sure the debate has ended or stabilized at anything, but how should we as a general population look at eggs? Is it okay to eat eggs, or what is your opinion?
Okay, that's another great question. Actually, let me mention something, that there are some people who think that the cholesterol is an innocent bystander and that it does not lead to health hazards, namely heart attack and stroke. This cholesterol myth is over. We know that the bad cholesterol, the LDL, the low density lipoprotein, is a causation rather than an association. So it is a cause, and that's of heart attack, strokes, and that's based on numerous long-term epidemiological animal studies and Mendelian studies and huge clinical trials that studied the effect of cholesterol on risk on our heart and brain over many years. So it's out of question that now cholesterol, bad cholesterol, is a causation of heart attack and stroke. And therefore, everyone should limit the amount of cholesterol in their diet. Now, we know that cholesterol is an essential material for the build up of our cells, especially the cell membranes. It's the lipoprotein. So it is an integral component of the cell that without it, the cell will not function properly. So we need cholesterol, but we don't need excess cholesterol. There are certain nutrients that are well known to increase the concentration of the cholesterol in our body that we should limit or avoid, especially people who already have high cholesterol or people who have a familial conditions called familial hyperlipidemia, whereby their cholesterol is sky high at an early age. And that's the highest risk because it can lead to premature death from heart attack and stroke. Now, those nutrients that include red proteins like red meat, such as beef, goat meat, and they should replace it or decrease that and replace it with white meat, which is the chicken breast and fish, especially fish that is very rich in omega-3, and usually that is the fish that is obtained from cold, deep sea water, such as salmon, such as trout, tuna, and Spanish mackerel, and cod.
Yeah. What about eggs then?
Well, eggs, unlike what used to be believed, egg actually is cholesterol friendly. So patients who have high cholesterol, they're not discouraged from eating eggs in moderation.
Okay.
Meaning 1 to 2 eggs twice, 3 times a week, that's fine.
Well, that's very helpful. With regard to exercise, I think that everybody believes that doing sports is healthy. I would imagine that doing sports is also a big challenge on the heart. So maybe there is also something as too much sport, or is that not correct?
Well, that's a good question. Now, for younger individuals who don't have history of cardiac diseases, who are otherwise healthy, they should be indulged in routine exercise, at least minimum 3 to 5 times a week, a minimum of 30 minutes of moderate intensity aerobic exercises, in order for them to reduce the risk of getting diabetes, high blood pressure, obesity, and other diseases related to those conditions. Now, for older individuals who have some medical problems, their exercise should be prescribed by the doctor, i.e., an individual who's diabetic and having hypertension who want to start an exercise program, he or she should visit his or her doctor in order for the doctor to assess the safety of them undergoing exercise, and once they are safe, to be informed about the intensity of their exercise. But in general, for older individuals, we try to advise them not to do overzealous exercises that are well known to predispose to injuries. And this is a big enemy of exercise. So we tell them just take it easy, just exercise daily, or at least 3 to 5 times a week, 30 minutes of brisk walk, where if a person is walking and he can talk but he cannot sing, or when he's conversing with his friend while he's walking, he has to stop because
Starting to get out of breath.
exactly.
Yeah.
So it's very important to exercise, but not to do it to the point of injury, because the last thing we want for older individuals is to have broken hips and knees injury that can lead to bad consequences and mobility issues.
Yeah. So I think that if what if we would say that anybody of any age, if they walk normally, so not brisk but normal walk, 1 hour a day, it would be enough exercise. Would that work, or is that not enough?
Actually, every step counts. Every step is an important. We always tell our patients, try to eat less and walk more. So fewer steps better than no steps. So in general, patients, we do understand that exercise on a regular basis can be quite a challenge. People are busy, or they can be lazy, or they're not accustomed to exercise. So you're asking them to exercise 5 times a week. They might not really be able to afford it, for one reason or another. But the minimum we ask our patients to do is to exercise at least 3 times a week.
Okay.
30 minutes of, if they can do it a little bit brisk, if not as much as tolerated.
And I want to thank you for sharing all these excellent advices with us. And I hope that people listened and that they can take it to heart, pun intended. And that I want to thank you for giving us your time and your expertise. It was very educational.
Thank you, sir, for the opportunity. And best of luck for all of our patients.
Thank you.